Welcome to Glowtime with Jackie. It isn't about chasing youth, it's about owning your glow, reinventing your story, and showing up like never before. Glowtime starts now.
Welcome to episode 5, Glowtime with Jackie. I'm here with Joan Freeman. She has spent decades guiding patients through surgical and non-surgical procedures. She's taken them through transformations in the plastic and reconstructive field. She's been there from the very beginning since 1983 with plastic surgery, and she's even still now in the industry. She has even written a book about it, Facing the Cut. Joan Freeman, welcome to Glowtime with Jackie.
Oh, I'm so excited to be with you, Jackie. It's great to have this conversation with you. I've looked forward to it.
Yes, it's so much fun. Thank you for being here. Mm-hmm. And before we start, let's go into a little cheers. This is a tribute to alcohol-free living for me, as you know.
Whoops.
It's okay. So we are just going to do a little toast. We're going to get all the tea in plastic surgery. We're going to have this tea. And have this a great show, episode 5, Glowtime with Jackie. We're going to get all the tea, plastic surgery.
We'll get at least some of it.
At least some of it. Let's
get
into it.
Yeah.
Okay. Let's talk first a little bit about how we met, Joan.
Yes, I think I met you in 1997.
1997.
And I think I hired you for your first job in plastics.
Yes, you did.
And I've been with you since, and you've been with me since.
Yes.
You've been such a phenomenal employee for many, the several plastic surgeons we've worked with together. And I've really enjoyed knowing you. You're really delightful. And I'm happy for this new change you're making now. It's awesome.
Yeah, I know. This is fun. What I love is that I can bring in the plastic surgery practice to it, talk about it, showcase it. Mm-hmm. Especially now, plastic surgery is so popular.
Right.
And that's where the topic is today.
It is.
Is that before, I remember everything was so secretive. Mm-hmm. Everything was one patient in the waiting area so that nobody knew. There was a back door that patients walked in and out of.
We actually had to cover the glass door because people didn't want to be seen.
Right. They didn't want to be seen. Phone calls, mm-hmm. Everything was very anonymous. Even sometimes patients wouldn't tell their significant others about it because it was very much taboo. Mm-hmm. So I want to talk about that. I want to talk about too, in the practice when I started with you, and everyone probably remembers this, there was a commercial. It was Institute of Cosmetic Surgery.
Right.
It was the only commercial running for plastic surgery. Mm-hmm. And back then, when I started with you in 97, there was actually a such thing called the Yellow Pages.
Right.
Yeah. Some of you young people don't know what the Yellow Pages are. It was a book, and that's where you found businesses.
Right.
So again, the evolution of plastic surgery is everything, right? Technology too, but we would look through a book to get, whoever had the best ad would get the most business.
Right.
Well, you took it a step further and went to TV.
Right. That we were among the first to be on TV. I remember there were other commercials done, but they were not plastic surgeons.
Right.
Some of them were doctors in other medical specialties who called themselves cosmetic surgeons, but we were one of the first plastic surgeons. I remember that very vividly.
Yeah, me too.
It was interesting.
The other thing I remember is when the commercial ran. It was drop whatever you're doing.
Right. The
The lines are ringing, and literally it was like a movie. The lines were ringing. We used to have to pick up, get all the names, and you'd have to just not think of anything. Literally drop what you're doing, get all the names, say, Institute of Cosmetic Surgery, hang up, get the name and number, and hang up, next call. And it was like probably 6 or 7 of us doing it all at the same time.
Mm-hmm.
So there was definitely a demand for plastic surgery. Mm-hmm. It was just on a different level than what it is now from the standpoint of people wanting to know that they had plastic surgery.
Mm-hmm. Exactly.
It was a secret. Yeah. So that was 28 years ago. Do the math. That makes me 38.
Well, you do the math for me. I've been in the industry for 42 years. I actually started in August of 1983.
Wow.
And even back then, it was we always had an eye on branding. I understood what that was. I understood the business of plastic surgery. Mm-hmm. And I think that was what I brought to the fore is how do you, as a physician, because they don't learn any of that in medical school. So you have to have someone maybe from a business background that understands advertising, and that's what put us ahead, and it always has.
Yeah.
And it always will.
Yeah, it always will. And then, of course, we went to different practices. And the last practice that I went to, that I'm at currently, my Body MD Plastic Surgery, Dr. Bedros, you called me.
Yes.
And I remember the first time you called me, I said, I'm not ready yet.
I know.
And you said, okay, it's okay. Just let me know when you're ready. And then I made the call a little bit later, and I was like, Joan, I'm ready. And here I am 13 years later.
And he's awesome. He is what I would consider the best of the best, because he's double board certified plastic surgeon. He doesn't do anything that's really way out. That's what I love about it. He's pretty conservative. And I love the results that he gets. And I referred patients to him because he'd be my go-to. Of all the surgeons that I know, he's probably absolutely the number one. I have to say that.
Awesome. Thank you.
I really love him.
Yeah, we'll have to send him this clip.
Yeah.
So, Joan, let's start with Botox. So when we got into the field, when I got into the fields with you, Botox was still not FDA approved.
Right.
And I will say Botox did a really good job at branding itself, because even though I prefer Dysport, I still call it Botox.
Right.
So talk a little bit about the Botox, so what you remember.
Well, what I remember, it was an easy transition between what we had been using in the past, and then Botox was just, it seems like a natural evolution of things. But I like Dysport too, and Xeomin was another one that was a brand name. Those three are competitors, Botox, Xeomin, and Dysport. But I think that people don't tend to look so much at Botox as an age-related thing, like you and I'm getting older and I need to erase wrinkles.
Right.
I think now we're using it with fillers, and it works well with many things. So I like the concept of at least being able to use something that gives you more of a natural look without cutting.
Yeah. When it first came out, though, it was the first of its kind, because there was really nothing like it that really stopped the action of muscles. And it was an accident how it came about, because it was a treatment for strabismus for your eyes, rapid eye movement. And then they realized, like, oh, wow, this patient's wrinkles around their eyes are also minimal.
Right. So
let's do it from a cosmetic standpoint. Started being used. And then in 2002, it finally became FDA approved. And that was just incredible, because, it had already made a name for itself. Right. And then it was the only product of its type for, I want to say, till 2009. 2009 is when Xeomin actually came out.
Right.
So, and it's still the number one kind of lunchtime procedure. It's the number one aesthetic procedure still in the world, because it's so easy to do. You get really good results. It lasts the downfall is that it lasts for 3 months, 3 to 4 months, depending on the person. But that can also be a benefit too. And it's pretty easy to use, and you get really good benefits from it. Yeah. So then after that, the fillers. The fillers is another one that's quite interesting, because back then it was bovine, which is derived from a cow. And you used to have to do patch tests.
Right.
I remember we used to have to do a patch test, and this was usually for lines around the lips, or even to fill the lips just a little bit, or the nasolabial folds, which are like the laugh line. So we would use collagen for that. And I remember having to do a patch test, wait 3 or 4 weeks till they could actually come in and have the procedure.
Right.
Now, the allergic reaction was very minimal, but there were some patients that, yes, you did have an allergic reaction. So we would inject it in their arm, wait 3 to 4 weeks, and they would come back, and then they could do it.
Because I remember the collagen, which was, again, which you're mentioning, using it from 1985 until the Botox came out and other fillers came out. And then we were also using body fat. Remember that?
Yeah, I do remember that.
They would harvest the body fat after surgery, and they'd spin it, and then it'd go into a syringe and into the refrigerator until a patient came in to have the next fill.
Yeah.
So that was very interesting.
I do remember that. And even still, that's a great tool now to still use. You can actually get more volume from just a little bit of fat that's removed from the body. And you can actually get like 20 syringes from the face versus, a syringe of hyaluronic acid that costs so much more money. It would cost more. So it's more cost effective if they can do it in the office procedure.
The thing about the hyaluronic acid, though, it is reversible.
Yeah, that's true.
And that to me is big, because a lot of times patients come in, they ask for something, and then they may not like the result. So I like the fact that it's reversible.
That's very true.
And it doesn't. The thing I also like about it is, instead of you having to have a complete facelift where you look drawn, it's a very natural result. That's what I really like about the fillers.
Yeah, I agree with you. So a lot of times too, I think what's happened as plastic surgery has evolved and plastic surgery has come to the forefront, patients are younger. They're getting younger and younger, because before they were definitely much older, maybe in their 50s,
Right.
before they actually got plastic surgery. We're seeing patients as young as in their 20s getting fillers and Botox and, toxins.
Right.
So what is your insight on that? Do you feel like what's caused that change? Do you think it's because of the social media?
I think it's preventative. I think a lot of younger patients are coming in just because they don't want to see themselves age or whatever. And so a lot of times they're doing it for preventative measures. So I think it's okay if you want to do it that way. I think for me, because I know what these procedures are and what they can do to the body, I'd be a little more conservative in my estimate of when I'd want to have it done.
Yeah, I agree. I think with our practice is sometimes patients come in, they really don't need it. I mean, obviously a lip filler, sure, that doesn't really correlate with your age if you don't have small lips, but definitely Botox, Dysport. If you really don't have lines, you should really wait.
You really should.
But I do understand maintenance. I mean, I think I was probably about 35 when I finally started getting Dysport, Botox, and it just really helps stop the action of the muscles, and it just really helps the lines to not form, just the wrinkles, the creases to just help them not form. So I think there is something to do with, just being preventative, but there is such a thing as just waiting till, it's kind of your time to have it done.
Exactly.
And two, I do feel that as you get older, the more fillers and things that you do, the older you look.
I think that's true. I think I can almost look at somebody and tell if they've had fillers or not. And some people, will allow them to just leave the body, through its natural process. But a lot of people are regretting they've had it done. And I see a lot of stars are saying they're getting rid of their fillers and whatever. And I don't know what the reason for that, but I do think that it can make you look older in some instances, not all of them.
Yeah, not all of them for sure. If it's done, with just a little bit in precision, it can definitely do the trick for sure. Well, let's talk about one of the new age things, which is the Brazilian butt lift.
Oh, goodness.
So we've talked about this. So back in the day, it was about sucking out the fat.
Liposuction.
And getting rid of it. Maybe a little bit in the face here and there. But now it's like repurposing, putting it in other areas, even the breast, but definitely the buttocks. And I feel like it's just gone from 0 to 100 really, really fast.
It has. And unfortunately, I've seen people who, and honestly, when they turn to the side, they've had something done, because it's unnatural looking. I've seen a few that look really good, but for the most part, when they go too large, it looks like the body is distorted. And that is not, to me, that's not what I would call aesthetically pleasing. I think that is quite unattractive. But if you like it, I guess you like it. But
yeah, it's definitely the trend thing. I hope that the trend is going to change, where it's just, I get a little bit of fullness, especially with all this weight loss, Ozempic. There's such a thing called Ozempic butt that we're seeing in the practice a lot. Patients lose a lot of weight. They have this excess skin. They literally lose their muscle and fat, and they're looking for places to get fat. They don't have fat anymore.
That's different, though, than from someone who is at a healthy weight and they want to add volume, and then they look like a cartoon character.
Yeah.
It's not pretty at all.
Yeah. And also the thigh. I always look at the thigh ratio, like the thigh to butt ratio. There's got to be a little bit of some kind of muscle or thickness on that thigh. It can't just be like two little sticks and then you have this little butt, because then you definitely start looking like a little bit of a beetle.
It's unfortunate, because this procedure, I think of all the procedures done in cosmetic surgery, is probably the one that people have one of the greatest rates of death from, or paralysis. I saw a video that you sent me the other day, and I thought that was very sad. This woman had gone to a medical spa, and she didn't check out her doctor. When she asked about his board certification, she thought he was board certified in plastic surgery, but he was not. He was board certified as a general surgeon. And then she ends up almost without the ability to speak, the ability to dress herself. I mean, I don't understand. I think that is one of the risks that you incur great risk with that procedure, especially.
Yeah, I think as women, we have to do our research.
Right.
We have to go to a physician that's credentialed to do these procedures. Don't go to med spas.
Right.
Don't go to just a fly-by-night, fly-by-day type practice. Go to a doctor that knows. Don't fly out of town just because of the price.
Right.
Because really,
and
what
a
you're
lot
doing,
of people do that.
yeah, you're putting a price on your life.
Right.
Is really what you're doing.
Exactly.
Complications. We see so many patients that come to our office. Complications. You know, at that point, Dr. Bedros, it's going to cost a lot more money to fix things. And really, if you just take the time, you know, vet the doctor, pay what you have to pay, there's a reason why these doctors have, you know, aren't the cheapest in town because they're very experienced and really the risks are minimum.
Right. And that's what I think that most patients, when you say this is how you vet your doctor, if someone tells you they're board certified, you can go to the American Board of Plastic Surgery and put their name in. It's going to come up if they're board certified. If they're not, it won't. So that is very simple to do. But most people won't do that. They will trust what is on a website. And again, my problem with is you can put anything you want on a website. It is not regulated because they don't have enough people to regulate and read each website to verify if the doctor is who he says he is. So that's how a lot of people get in trouble. I remember one year we were running, I heard a commercial or something on a radio show, and this they were saying that the doctor was board certified, but and so I called up and I said, what board is he certified with? And she said, oh, he's certified by the American Academy of Cosmetic Surgery. I said, that is not a medical specialization, so he's not board certified, but you have to know that. And this is where I think patients can really avoid problems if they would just take the time to do the research.
Yeah, I totally agree. Because then you end up having so many other issues with not feeling good about yourself after the procedure and then having to spend money and then you're just not happy even after you had this procedure done. And then that leads us to, you know, it being an inside job. So with all plastic surgery, you can get all the plastic surgery in the world. If you are not happy with yourself, you are just not going to be happy with the result. It's just not going to happen. You still have to do that work inside. There's a lot of times that we saw patients doing procedures for their husbands.
That's right.
For their significant others versus for themselves. And guess what? You're not going to be happy.
Exactly.
You're still going to be in that.
We saw that all the time. When a patient comes in, she brings her husband and he wants her to have triple D breast and she wants to be a C cup. And if she gives in to what he says, she's never going to be happy because it's not coming from within her own self. She doesn't know what she wants for herself. She doesn't know herself well enough to say, no, that's not what I want. And then she's unhappy with the result. And that's pretty sad, but we would see that quite often.
Yeah.
And so a lot of times I would try to talk to the patient one-on-one and say, look, you need to make the decision for you. You can't make it for him. You can't make it for anybody. It's got to be because it's what you want. And if you don't get what you want, you're not going to be happy.
Yeah, totally agree. But then there was some transformations that were just so beautiful where you really see the patients like, it's like the butterfly. They were in a cocoon. They were not happy with themselves. They loved themselves, but they were just needing that missing piece, that extra component. I can think of one lady that I will always remember. She was beautiful, kind of shy, you know, but she was very flat-chested. And she wore turtlenecks like in the summertime. She was just not, you could tell she was not happy. She had a breast augmentation, nothing extra big, and she just blossomed. She was just a different person when she came in, and I love to see that. I really love to see that. Another great transformation is when patients lose weight, because here they've done a lot of work, worked hard for the weight loss, and then they're still left with all this skin. And they just feel a little bit still defeated. And here, when they can get that skin removed, you can just see that they just are, you know, in their
on top of the world.
Yeah, they're on top of the world. They just love it, and they're really proud of themselves. themselves. And I love to see those transformations. And I really feel that's one of the biggest reasons that I've stayed in plastic surgery and really feel that it's where I needed to be.
It's an extremely exciting and interesting field because of how quickly things change. Technology has changed a lot in plastics. It's so different than when I was a practice administrator. Things have changed just in the last 10 years. I mean, last 5 years, things have really taken a great leap forward, I think.
Yeah, absolutely. Let's talk about your book. So your book, Facing the Cut. So you basically go in there and you advise patients about basically you advise the patients about what to do, what to look out for a board certified plastic surgeon, do your research, some misconceptions. You just kind of shed light on plastic surgery.
Right. So can I share something with you from my book?
Of course.
And when I went back and I looked at this and I thought that's really pretty good. It's about the psyche of patients. Dr. Maxwell Maltz, he wrote a book called Psycho-Cybernetics. And when I was doing the research for this book, I could not find any book written by a layperson on plastic surgery. And I couldn't find really anything written by a doctor that would really instruct a patient on how do you find the right plastic surgeon. But it says here, to understand the psyche of patients is to recognize that happiness requires looking beyond physicality into the soul. The inner being is seeking more, though we don't know this on a conscious level. The truth is that we are all, in one sense or another, wounded in some way. And so those wounds create in us an opportunity where we're not sure why we're not sure what we're looking for. We're not always positive on that. But each one of us is creating a life based on how we think and how we perceive ourselves. Whatever we imagine about ourselves, we create, for good or bad. We can only perform at the level we see ourselves performing. And so the problem is not on the outside, it's deep within, just like you're saying. So when people understand that, we have a yearning to become more, to expand, to be greater than we are. That yearning comes from our soul. And so when you're not in touch with yourself spiritually, then you can run in different directions. You can run it's like running loose almost, because you're not sure what you're looking for. You're not sure what you're wanting. And that's where I think we need guidance, especially when we're making decisions that are life-changing, like altering your face. All of these things are done because we are seeking something within ourselves, something that says, let me out, let me become greater than I am. And those are great things. And I think plastic surgery goes a long way in helping people achieve those goals.
Yeah, I totally agree with you. Thank you, Joan, for being here with me today. Thank you for taking the time. Thank you for talking about your book. And we went from Botox to Brazilian butt lifts and, we're looking forward to seeing how plastic surgery evolves from here.
Right.
Thank you again for being here. On this note, let's another toast to, now we got the scoop, we got the tea from Joan. And may always be on the good side of plastic surgery.
Right.